Good day, I'm Vicente from BSN 3A, and let's talk about the Glasgow Coma Scale. The following objectives are introduction, definition, I score, verbal score, motor score, interpretation, and summary. For the introduction, the scale was published in 1974 by Graham Tisdale and Brian J. Jennett, professors of neurosurgery at the University of Glasgow's Institute of Neurological Sciences at the city's Southern General Hospital. A patient is assessed against the criteria of the scale, and the resulting points give a patient score between 3, indicating deep unconsciousness, to 15, full of consciousness. Definition: the Glasgow Coma Scale, or GCS, is a neurological scale which aims to give a reliable way of recording the conscious state of a person. Scale scoring: the Glasgow Coma Scale checked 3 components, which are I response 1 to 4, verbal response 1 to 5, and motor response 1 to 6. We have here the example of a Glasgow Coma Scale. For the I response, there are 4 grades starting with the most severe. First is the no eye opening. Second, eye opening in response to pain stimulus. A peripheral pain stimulus, such as squeezing the lunula area of the patient's fingernails, more effective than a central stimulus, such as a trapezius squeeze, due to a grimacing effect. Third, eye opening to speech. Not to be confused with the awakening of a sleeping person, such patients receive a score of 4, not 3. And lastly, eyes opening spontaneously. For the verbal response, there are 5 grades starting with the most severe. First, the no verbal response. Second, incomprehensible sounds such as moaning but no words. Third, inappropriate words, random or exclamatory articulated speech, but no conversational exchange. Speaks words but no sentences. Fourth, confused. The patient responds to questions coherently, but there is some disorientation and confusion. And lastly, oriented. Patient responds coherently and appropriately to questions such as the patient's name and age, where they are and why, and the year, month, etc. For the motor response, there are 6 grades starting with most severe, which are: first, no motor response. Second, decerebrate posturing accentuated by pain or extensor response, adduction of arm, internal rotation of shoulder, pronation of forearm and extension at elbow, flexion of wrist and fingers, leg extension, plantar flexion of foot. Third, the decorticate posturing accentuated by pain or flexor response. For example, internal rotation of shoulder, flexion of forearm and wrist with clenched fist, leg extension, plantar flexion of foot. The image shown was about the difference between decorticate and decerebrate posturing. In the decorticate posturing or the flexor, the arms are like C's, moves in towards the cord, and it has the problems with cervical, spinal tract, or cerebral hemisphere. While in the decerebrate or extensor posturing, the arms are like E's, and it has the problems within midbrains or pons. Fourth, withdrawal from pain. Absence of abnormal posturing, for example, unable to lift hand past chin with supraorbital pain but does pull away when nail bed is pinched. Fifth, localizes to pain. Purposeful movements towards painful stimuli, for example, brings hand up beyond chin when supraorbital pressure applied. And lastly, obeys commands. The patient does simple things as asked. This is also an example of Glasgow Coma Scale with score. For the interpretation, generally, brain injury is classified as: when the GCS is less than 8 to 9, it is already severe. And when the GCS is 8 or 9 to 12, it is considered moderate or controversial. And lastly, when the GCS is greater than equal 13, it is minor. A for alert with a score of 15, V respond to verbal stimulus with score of 13, P respond to stimuli, score of 5, and U for unresponsive with a score of 3. Limitations. First, tracheal intubation and severe facial or eye swelling or damage make it impossible to test the verbal and eye responses. The second limitation, in these circumstances, the score is given as 1 with a modifier attached. For example, E1C where C is equal to closed or V1T where T is equals to tube. Often the 1 is left out, so the scale reads EC or VT. And the third limitation, the GCS has limited applicability to the children, especially below the age of 36 months, where the verbal performance of even a healthy child would be expected to be poor. Again, I'm Vicente. Thank you for listening.